Hi guys, good morning. Welcome to another Tuesday session, AMA with Dr. Ben. Welcome, I'm Dr. Ben Benham, board certified dermatologist, and one of the co-founders of Happy Head. So today's topic is what is the cause of hair loss. So first of all, you have to realize that there are many different causes of hair loss. Most of the patients that we see in clinic, we always ask, hey, how does your mom, dad, grandpa, uncles look like? Usually some people say, hey, my grandpa was bald. So majority of people basically have a genetic predisposition to hair loss, and that's genetics. Then what happens is that basically through life, you have other stressors that add on. So for example, like thyroid disorders like Hashimoto thyroiditis, or you have low thyroid and you're on synthroid, and all of a sudden the medication that you're taking is too much or too little. So thyroid disorders could cause it. Stress generally is a very common cause. So your daily routine stresses basically could cause it. Also, major events. So for example, a major dramatic events, so like rapid weight loss, bad breakup, divorce, car accident, hospitalizations, those things could also basically accelerate those underlying genetic hair disposition. Also, the stuff they put in hair basically would affect it too. For example, I had a patient of mine who got a Brazilian blowout, and she lost 50% of the hair and never came back. I actually saw a patient yesterday whose dad left a leave-in conditioner for 2 hours on his head, poor guy, when he was like really young, and burned the entire front part of the scalp, and that front part never came back. So things that could physically damage basically your hair. I just did an interview with dermatologist on Friday, and the topic of conversation was traction alopecia. So very tight braids, pulling your hair back a lot. So that's also going to cause hair loss. So things that you do physically to your hair, like hot. Some people use like very hot liquids or hot stuff. Those could damage your hair. Genetic predisposition, endocrine, which means your thyroid, low vitamin D, low iron. What you eat. So, for example, yesterday actually I had another patient who basically he was doing a lot of creatine and a lot of protein shakes to really bulk up, and all those will increase your testosterone and will cause more hair loss. Some patients, are on testosterone therapy, and that will cause more hair loss. So there are a lot of reasons. So, and typically, when we're evaluating you, we kind of try to look at those many different reasons. And in our intake, we do ask some of those questions basically to make sure that we could sometimes really try to figure out what's going on. And sometimes we can't figure out what's going on. I mean, I had a 81-year-old female 2 weeks ago saying why she's losing her hair. Well, look, sometimes, as we get older, we start to lose hair. That's also another very simple explanation. But at the end of the day, no matter, I mean, it's important to figure out why you're losing your hair. But at the end of the day, is how we're going to treat it. And I think that's really important, because the earlier we treat the hair loss and address some of those signs and symptoms, the better it's going to be. And again, there's also like autoimmune conditions like alopecia areata, which I have. There's also scarring hair loss conditions like cicatricial alopecia, which some people have, like in the African American population. Again, so a lot of things could happen. Again, you just gotta see sometimes your dermatologist to really be evaluated for it. Okay, guys, I'm excited. We have a lot of questions here. Let's get so. Here we go. TRT and finasteride. Great question. We kind of talked about that briefly. TRT stands for testosterone therapy, basically topical testosterone therapy. And so some patients need it. I mean, the testosterone goes lower, and they're gonna need it. Um, so look, you need testosterone, you need it. So the problem with testosterone is that it could increase DHT levels in your body and cause more hair loss. So we do put patients basically on top of finasteride, and that will basically help combat some of the DHT levels that being caused by the TRT. And look, I always say ask your doctors to make sure your doctor is okay with it. But finasteride is okay, and we've used it in a lot of patients in the past with very good success. So if you're on TRT and if you have to be on it, then finasteride is a good choice. Now, if you don't have to be on TRT and you're on it for the fun of it, which I do have some patients on like that, I would recommend getting off of it, because that's going to cause hair loss. Oral minoxidil risks. So great question. I mean, as you guys know, we are coming out with our super capsule, which is a combination of oral finasteride combined with oral minoxidil and vitamin D. So, and we prescribe a lot of oral minoxidil. I mean, we do it a lot through Happy Head and in my personal office. I mean, just last week, I think we just did 50 or 70 prescriptions just last week. So, oral minoxidil, the blood pressure medication that's used off label for hair loss in both males and females. Most common side effect, it could drop your blood pressure. It's intended to use for high blood pressure. So that means it could lower your blood pressure. Side effects include dizziness, lightheadedness, which is rare. I mean, obviously, if you're a very petite girl, I will be a little concerned. Typically, most guys do well. Other side effect includes headaches and heart palpitations, which means basically racing heart. Chest pain, shortness of breath is rare, but it could happen. We had a patient of mine that basically didn't touch it up as I told him to, and he got chest pains. But it could happen. It's not dangerous. It just could happen. And then lower leg swelling could happen. Pretty rare, but you should really watch out for it. I think oral minoxidil could sometimes work better than topical minoxidil. We typically recommend that patient titrate up, which means when you're gonna get the super capsule. Don't take the pill every day. Our method is going to be touch up technique, which means take 2 capsules a week to start out with, then 3 capsules a week the following week, then 4 capsules. So you're going to go up slowly. If you have the tablet, basically get a pill cutter and cut the pills in a quarter. So then you'll take like a quarter of tablet every day for the first 2 weeks, and then you're going to go up to basically half a tablet. Great question. My hair has shown minimal effect in 6 months of topical finasteride. Should I keep with it or stop? So this is what I would recommend. A lot of our patients I have patients on oral and don't respond, and there's sometimes patients on topical that don't respond. Keep up what you're doing, but add another method of treatment. So if you're having a topical with no side effects, but you haven't seen much respond, add the oral finasteride to it, or add oral minoxidil to it. If you've been on oral finasteride for 6 months and you don't see a response, add topical finasteride to it. So don't stop one. Continue that one that you're doing and add another method, and I think you're going to see much better results. By the way, yesterday I saw a patient in the office who was on oral finasteride and topical finasteride, and he was on it for 6 months. He came back. I'm like, "How are you doing?" He's like, I don't think I'm doing that great." So I took the before and after photos, and I swear, guys, he had grown so much hair, and so, but he didn't notice it. So the question is, why didn't he notice it? The reason is because you look at yourself every day. So this is why it's so important to take photos at the beginning. So sometimes, patients say, I don't see improvement, but in reality, they've gotten amazing improvements. So take photos at the beginning, take photos on a monthly basis, not every day, just on a monthly basis, and compare the photos. And I think you're probably going to see, you'll see the difference. Will topical finasteride cause low libido and ejaculation issues? Look, anything is possible. If you look at the clinical studies, the risk of topical finasteride causing sexual side effects is almost 0.3%, whereas with oral finasteride is about 2 to 4%. So although the risk is there, but anything could happen, but it's much lower risk. Now, if you're concerned about the side effects, we could always start you at a lower dose, do a finasteride 0.1% as opposed to 0.25%. And that's very easy. Just email us at help@happyhead, and our help desk will help you. How soon does the hair start falling out if you were to stop suddenly? Actually, it usually doesn't fall out right away. It takes several months, 3 to 6 months. How often should you wash your hair? And what should the water temperature be? And should I be blow drying? And what about conditioner? Great question. So I typically recommend 2 to 3 times a week washing the hair. We do have a really good shampoo, by the way. And I got compliment on yesterday by my mom regarding the shampoo. So that's actually really good. She said it works really good with hair basically that are highlighted. I'm like, great. Water temperature. I don't think the water temperature really makes a difference. I do like conditioner, especially if the product is irritating your scalp. We use a leave-in conditioner. And blow drying. Yeah, so it's a blow dry. So this is what I was talking about right at the beginning of our conversation. You have to be careful of blow dry. First of all, you don't want to be at the highest heat level, really close to your scalp, like where you're burning your hair follicles. I've seen it, guys. I've seen all this stuff in my office. That's why I'm saying it. Keep it away. Lower, cooler setting. Lower, cooler setting. Short period of time. Don't blow dry all the time. So I've been a finasteride for 20 plus years and noticed I was losing my hair still. I switched to oral finasteride, but I didn't like the side effects. Now I'm back on oral finasteride, 2.5 milligram oral minoxidil, 0.1% dutasteride, 2. Is this too much? Great question. So let's talk about this for a second. So we all know basically that patients that are on finasteride, either orally and topically, at some point could plateau. And this is what has happened to you. Switch over to oral finasteride, has some side effects. Back on oral finasteride and added oral minoxidil, which I love. This is practically the super capsule. Also added a topical 0.1% dutasteride, so which is fine. I don't think this is too much. As long as you're not having any side effects, I'm okay with it. It's fine. I mean, in my personal office, I do have patients on oral finasteride, oral minoxidil, and topical happy head. The finasteride version of topical happy head, and they do really, really well, really well. So I will continue it. Um, what is the best way to learn what is causing your own hair loss? That's a very good question, and again, everyone's different. Again, number one, you need lab tests. That's number one. Number two, you have to see if there's any autoimmune things going on. Like if you have scarring hair loss, non-scarring hair loss, alopecia areata, and number three, some of those external factors we talked about, like are you vegetarian? Have you had the COVID shot? By the way, we are seeing a lot of this. A lot of patients with COVID, who had COVID, basically tend to lose a lot of their hair. They're going to telogen effluvium. And also, sadly, the COVID shot is also causing a lot of hair loss too. So, I mean, a lot of those things basically will affect it. You can always get on a phone call. You can see your own dermatologist, and they'll be more than happy to assist you. Or fly out to LA. I'll be more than happy to see you. What is your opinion on TED for hair restoration? So basically, the TED device is like an ultrasound waves and air pressure that basically drives some of the components of this chemical into your skin. So it's a good question. So basically, what's going on is that they have this hair formula, and then they have this device that's pushing down the fluid into your scalp. So it's a much more fancy version of like you putting the topical on and you dermal rolling it in, basically. It's similar device that I've been around for a long time. There's another one out there. I forgot the name of it. In the old days, what we used to do, we used to take a CO2 laser and laser the scalp, and then had the patient basically put topical things on their scalp. But honestly, I don't really think all that is necessary. I think if you just put a topical on and use a dermal roller, you're gonna see similar, if not better, results. Is hair loss truly prevalent in people who follow certain diets, vegan, vegetarians? That's a very good question. Yes. So if you're vegan, vegetarian, the problem is that you're not getting enough protein in, and your hair is all protein. So in those cases, what typically recommend, we say increase your protein uptake by adding whey protein concentrate to your diet. So the two type of whey proteins, concentrate and isolate. Isolate is bad because by definition, what isolate is that they have taken certain amino acids like valine, isoleucine, leucine, all that stuff, and arginine, and they have increased the dose from about 200 micrograms to about 2,000 micrograms, and it's intended basically for muscle building. So, but the problem with those amino acids is that it increases your testosterone level, and that's what causes hair loss. It's great for muscle building because you need testosterone for muscle building, but it's bad for your hair. So we typically recommend whey protein concentrate, and you could buy that on Amazon. There's a brand called NutriCost. You could buy it, make a smoothie out of it every morning and drink it. And I swear, I have patients, especially females who are vegetarian, who've just been on the protein shake for like 4 or 6 months, and they come in and their hair is just naturally thicker because now they're having the protein that they didn't have before. So there's also, you could do pea protein as well. So if you're vegetarian, it's somewhat a problem. And honestly, I see that every day, all the time. I mean, we're in LA, half the people are actresses, and they're all vegetarian, and they don't. But I always encourage them more protein, more protein. Um, so what can vegetarians do? So again, just add protein to your diet. Eat just more natural proteins like avocados, cashews, almonds. Those are all great. And also add collagen to your diet. You could buy collagen powder. I like the Vital Proteins brand from Whole Foods. You can also buy it on Amazon. Mix it with your protein powder. Make a smoothie and drink it every morning. Yeah. It's Vital Proteins. It's pretty popular. Vital Proteins. Is it vegan? I think it is. Yes, okay. It's vegan and it's kosher. I think it is, but yeah, I got to double check. It's very popular. Um, that's the one with the Jennifer Aniston advertises. Again, I have no personal link to him. I think they're good, but you could also go on Amazon, and there's also like collagen, like liquid that you could basically buy. The collagen tablets that you could buy, collagen gummies you could buy.
Throw it in a protein shake.
Pour it in a protein shake and drink it. Cool. Is it beneficial to have complete proteins in one's diet to minimize hair loss? Yes, it is actually really important. And remember, your hair is all protein. So, and I always say that, there are four pillars of hair loss. And what it is vitamin D, iron for females, protein, and collagen. So if you really need to have all those, if you don't have those four things, no matter what you do, you're not going to have amazing, great hair. Is protein what makes up hair, and is having a lack of protein contributing to experiencing hair loss? Yes, your hair is made out of protein, so you need that protein uptake, basically intake, to really have good hair. The more protein intake, the better hair you're gonna have, the better it's gonna look, and the multivitamins, the vitamins in the protein is also important too. They say that your trait for hair loss comes from your mother's side. Do they come from your father's side as well? Is the whole thing a myth? Great question. We should have like Mythbusters, like a session of Mythbusters. Yes, it's a myth. It actually comes from both sides, actually, both male and female. So it is not just the mom. I don't even know how that rumor got started, but yeah.
That's something I wanted to know.
Yes. I also learned it when I was in med school. Yeah, it comes from the mom's side. It's not true. Is hair loss caused by nutrient deficiency? Are there any supplements one can take to stimulate better hair growth? So here's the thing. So, yes, nutrient deficiency could sometimes cause it. Again, as we said, proteins are important. Vitamin D is important. Iron is important, especially for females. So if you check your labs and your ferritin is like below a 10, that's really bad. I mean, no matter what you do, your hair is not going to grow out. And sometimes you need like IV iron infusions basically to really bring that number up. And some people are just naturally low in iron, but taking an iron tablet every day is great. Iron could be constipating. So my recommendation is that Whole Foods has this liquid iron, is the 18 milligram liquid iron from Whole Foods. I know I keep mentioning all day, but I have no association with them. Jeff Bezos does not pay me, so they have this liquid iron, which is good. I like it. It's not that constipating. So get an iron tablet. Vitamin D, we see this all the time, and honestly, I rarely ever see a good iron level and vitamin D level in people. So, vitamin D is important. Take your vitamin D 2000 every day, and that's where super capsule has vitamin D 2000 in it. And then biotin. People everywhere ask biotin. So here's the thing. So I don't think most people in the U.S. are biotin deficient. Obviously, adding some biotin to your diet is important, but as pretty much most people know, they've already added biotin to their regimen, and hair hasn't grown back. So biotin is not the cause, but it could definitely assist. So, but again, you could also like check your vitamin B6, B12. So those are also kind of important as well. But the most important ones: vitamin D, D3, iron level, um, and the vitamin B is also important. Whenever I apply Happy Head and Derma Roll, the roller catches on my hair. The topical makes my hair sticky and greasy. Is it okay to derma roll first and then apply topical? Yes, you could do that. Also, you could buy something called a derma stamp. So a derma stamp is basically a stamp, so you're not rolling it. Is a stamp. There's also something called like a derma pen, which is like the electronic basically one, so they don't really get stuck. If the product is very sticky, email support, and we could actually take the aloe out. It's the aloe that's causing the stickiness. Can lack of sleep cause hair loss? I mean, not directly, but what's going on is that the lack of sleep causes your cortisol level to go up, and cortisol level basically affects your DHT levels, and that's what causes the hair loss. Can wig adhesive cause permanent hair loss? Yes, absolutely. I've seen it. I've definitely seen it. So you have to be careful. I sadly years ago I had a patient of mine who literally cried for almost an hour in my office just because the wig caused more hair loss because the adhesive. So you have to be careful. If hair is kept in a protective hairstyle, such as braids, can happy hair topical still be used? Would oral be better? So obviously, if you have braids, you could obviously put the happy head in between the braids, so it could help. Oral will obviously assist and help as well. I mean, obviously, the orals could sometimes be easier in your situation, but you could still apply. I have a lot of patients that still apply happy head in your case as well. Are there different side effects for oral spironolactone? Yes, there are. So spironolactone is the number one actually pill for female hair loss in the U.S. And I'm the number one writer of spironolactone in LA actually.
Yeah.
But the issue with spironolactone, and although it's a great medication, is that it could cause hormonal changes. So first, there was a blood pressure medication that's used off-label for hair loss in females. We usually do not use it in males. It could cause, lower blood pressure like dizziness, lightheadedness. It would cause breast tenderness, irregular periods. That means you're going to have spotting between your periods, and sometimes patients could completely lose their period. It could also make you pee more, so it's a diuretic, so you could actually pee a lot as well. It could also elevate your potassium level. So which is not great. So you have to avoid bananas and coconut water, and obviously don't get pregnant on it. Years ago, we used to check labs on everyone. This has kind of fallen out of style, believe it or not. So only about 5% of U.S. dermatologists in the U.S. now check it. So it's really not that necessary anymore. I've become more of a fan of oral minoxidil compared to oral spironolactone for females. The topical one, it's actually okay, and the topical one has less just lower side effects, so most patients won't experience all those hormonal changes, and it seems to be fine. Well, the medication worked for traction alopecia, hair loss caused by excessive pulling tension on the hair. Uh, it's a traction alopecia. That's a tough one. We have an article in Healer Dermatology coming out. We just did the interview on Friday. It's tough, and yes, it could work. My recommendation is first of all, loosen basically the hair ties. Don't be very tight. Don't be very tight. That's recommend number one. Number two, yes, you could put a happy head on and then dermal on top of it. That it will really tends to help quite a bit. And if that doesn't help, PRP also helps in that instance quite a bit. Can taking oral medication cause facial hair growth? The minoxidil could. Oral minoxidil causes facial hair growth, especially at the full tablet, 2.5 milligram. We usually have patients be on a half a tablet, so on a half a tablet is less likely. Usually the hair growth happens more like darker skin individuals, like African Americans, Middle Easterns, Indians, Hispanics, less likely in Caucasian skin. At least it won't be obvious. Is stress a cause of hair loss? Absolutely. How can stress play a factor? Is it worth taking medication in this case? Well, I have to continue taking this forever. So here's the thing. So stress will cause hair loss in many different forms. You could have the normal regular stress that basically what it increases your cortisol level, and cortisol level increases your DHT level, and that's what causes the hair loss. But you could also have like dramatic events like car accidents or rapid weight loss or having like a really bad COVID case where that could also push you into telogen effluvium, and you could lose 30, 40, 50% of your hair. So now there are some patients also that are just naturally anxious people, and in those cases, what I would recommend is sometimes I would put patient on Zoloft. Zoloft is an anti-anxiety medication, and I usually put on a very low dose, like 25 milligrams, which is extremely, extremely low. And it just takes off the edge, and honestly, patients feel better. So, but again, you really have to see someone in person to really determine that. Is hair loss really hereditary, or are other factors playing as well? It's a combination. So basically, it's genes, is how stressed your life is what you do to your hair, what you eat, and like stressful events in your life. It's all that basically that plays a factor, and also your nutrition, and also your vitamin levels of vitamin D and iron levels and vitamin B6 and B12 levels. So all those basically will play a factor. What is the best of basically learning what's going to cause your hair loss? I think you really gotta need to see someone in person, and they that's the best way, honestly. You just need a dermatologist has to see you, look at the hair, examine the hair, and they could talk about the different causes of hair loss. And again, else do your labs, but you easily have your doctor check your labs, thyroid level, vitamin B level, D level, check out an iron level, and it's first check the labs and see if there's anything going on internally.
We're out of questions right now.
Great. So, guys, a couple things to remember. Happy is customizable, which means you can actually customize it. So if you have any questions or any concerns about the product, like you want to lower the finasteride or the minoxidil, let us know and we will customize that for you and ship you out another one. If the product is irritating, we could ship you out the water-based formula. And and also we are coming out with our super capsule.
Yes.
So the super capsule is an oral minoxidil and finasteride vitamin D combined together. I think it's already live on the website. I think it is already live on the website. We could probably talk a little more about it. Also, we have our multivitamins live and our shampoos live. I'm really loving the multivitamins. Again, use my coupon or Evelyn's coupon, Dr. Ben 50 to get like 50% off. We want you guys to try it. Okay, guys. Well, thank you so much for that session. Thank you to my staff here and everyone else. If there's any questions, let us know, and we will see you guys next week. Have a nice day. Bye bye.